By Amanda Seitz and Lindsay Whitehurst, Associated Press, Washington. The Biden administration moved Friday to require patients see a doctor in person before getting attention deficit disorder medication or addictive painkillers, toughening access to the drugs against the backdrop of a deepening opioid. The proposal could overhaul the way millions of Americans get some prescriptions after 3 years of relying on telehealth for doctor's appointments by computer or phone. During the Drug Enforcement Administration said late Friday it plans to reinstate once long-standing federal requirements for PO. Patients will need to see a doctor in person at least once to get an initial prescription for drugs that the federal government says have the most potential to be abused: Vicodin, OxyContin, Adderall and Ritalin, for example. Refills could be prescribed over telehealth appointments. The agency will also clamp down on how doctors can prescribe other, less addictive drugs to patients they've never physically met. Substances like codeine, taken to alleviate pain or coughing, Xanax, used to treat anxiety, Ambien, a sleep aid, and buprenorphine, a narcotic used to treat opioid addiction, can be prescribed over telehealth for an initial 30-day dose. Patients would need to see a doctor at least once in person to get a refill. Patients will still be able to get common prescriptions like antibiotics, skin creams, birth control and insulin prescribed through telehealth visits. The new rule seeks to keep expanded access to telehealth that's important for patients like those in rural areas while also balancing safety, an approach DEA Administrator Anne Milgram referred to as expansion of telemedicine with guardrails. The ease with which Americans have accessed certain medications during the pandemic has helped many get needed treatment, but concerns have also mounted that some companies may take advantage of the lax rules and be overprescribing medications to people who don't need them, said David Herzberg, AHA. You don't want barriers in the way of getting people prescriptions they need. But anytime you remove those barriers, it's also an opportunity for profit seekers to exploit the lax rules and sell the medicines to people who may not need them. U.S. overdose deaths hit a record in 2021. About 3/4 of those from opioids during a crisis that was first spun into the making by drug makers, pharmacies and doctors that pushed the drugs to patients decades ago. But the grim toll from synthetic opioids like fentanyl far outstripped deaths related to prescription drugs that year, according to Centers for Disease Control data.